Hello, hi, welcome in. So you're here to get your allergies tested today? Okay, you came to the right place. Can I just get your name, please? Okay. Yeah, so it looks like you didn't make an appointment, right? That's okay. Yeah, we do take walk-ins, so it's no worries. Let's see. Yeah, we actually have a time slot open right now. If right now works for you? Yeah, okay. Great. Okay. Now, since I'm assuming this is your first time here at our clinic, yeah, okay. Then I'll just have to start a new patient file, and I'll ask you some questions and stuff. Okay. Yeah, just give me one moment here, and Right. So, yeah, your name was. But could you spell the last name for me, please? Sorry, just wanted to check. Okay. And then, what's your date of birth? February. Okay. And that would make you. And do you have any pre-existing medical conditions? Okay. And when were you diagnosed with that? Okay. Alrighty. Are you taking any medications? Alright. And are you aware of your height? Yeah, height and weight. If you don't know, we can measure for you, but just like a good estimation is totally fine. It doesn't have to be exact. Yeah. Okay. And then the weight was. Got it. Okay. And then what is your occupation, if any? Student or employed, unemployed, whatever your case is. Okay. About how many hours do you work per week? Okay. And do you exercise regularly? Okay. Alright, and when you go for walks, is that like outside or inside on a treadmill or something? Okay. Sorry. Got it. Okay, and then just regarding your diet, getting in the fruits and veggies, or as well as we can, yeah, as long as you try. Okay, and then how is your sleep? About like on a good night, how many hours would you say you get on average? Okay, yeah, that's not ideal, but I understand it can be hard to get to sleep sometimes, right? Okay, in terms of the basic information for the new patient profile, that's all I have. Let's see here. And now you are here for the allergy testing. So let me ask. There's a few more specific questions that I need to ask you before we actually start the allergy testing, just so I can get a better understanding of your background, which could tell me what to look out for the test. Yeah. Okay, so first of all, have you been tested before? This is your first time. Okay. And what made you want to get tested for allergens? Okay, so you have some rashes on your back that you noticed, okay. And about how big, or I don't know, you can just kind of give me a good, okay. Yeah, I'll take a look at it later, but just, and is it itchy or painful or just a visual thing? Okay, a little bit itchy. And when did that start? About a week ago? Okay. And is this the first time that's ever happened to you? Oh, you had it periodically on and off, okay. Alright. And then, do you usually get seasonal allergies? Do you tend to get a little bit stuffy and sneezy in the spring or in the fall? Okay. Alright. Okay, I see. And then, do you have any pre-existing allergies? I mean, you said you didn't get tested before, so never mind, I shouldn't ask you that. But I would like to ask about your family history. Do you know if your mother or father has any allergies? Mom is allergic to cats, okay. Cats. And have you been around cats? Have you noticed if that's something that bothers you? Okay. Yeah, we can get a certain answer on that today. Do have dog and cat dander included in our tests today for you. So, yeah. Alright, and then I need to know, have you taken any antihistamines in the past 7 days? Yeah, that would be something like Benadryl. I think some cold medicines have some antihistamines in them. Allergy medicine, perhaps Claritin. Yeah, because if you have taken any antihistamines, then we cannot do the testing today. I'll mess up with the results. Okay, alright. Yeah, we always just make sure no antihistamines in your system. That's good. And then some other things that I have to ask. Are you pregnant? No? Okay. Do you have asthma? Okay. And are you on a beta blocker medication? No, okay. If you said yes to any of those questions, then I would not be able to give you the allergy testing today, so that's good. I'll check it out. Alright. Yeah. So it looks like we are cleared to go ahead. Let me just give you a quick run over of everything that I'll be doing for your testing, okay? So first of all, I'm going to be cleansing the skin where I'll be doing the testing. We use a gentle alcohol cleanser just to remove any sort of lotions or oils on the skin, just to have a really good fresh base to test on. And then, so what we do is I apply a concentrate of, it's kind of like a little, almost like a serum type of consistency, where I'll just be dropping it onto the skin. And then I will be making a tiny prick in the skin on each part of where the serums are, and that will allow I didn't say that the allergens are in the serums, and that will allow the allergens to enter your bloodstream, and then we wait for a bit of time, and then we see how the skin reacts on those places, those little patches of skin. And yeah, so we have a few different groups of allergens. For example, we have tree pollen. We test things like elm, juniper, maple, birch, cedar, ash, just to see specifically what types of tree pollen might cause as your seasonal allergies. And then we have weeds and grasses, things like dust mites, certain bugs. Like I said, we have the pet panel, cats, dogs. And then we also do a panel for mold, different types of mold. And metals. Metals is also important. Like nickel or gold, silver, things like that, to know what sort of jewelry you should and shouldn't wear. Right. Okay. Was there any substance in particular, any allergen in particular that you wanted to test or that you were concerned about? Okay, so you were interested in the metals, right? Okay, so you're somebody who wears jewelry pretty regularly. Okay, so you think the jewelries that you're wearing might have some metals in them that could be causing the rash. Yeah, that definitely could be the case, so I'll be sure to do the metals panel on you. Let me just take a note of that. Right. Okay. Right. So then after I apply all of the allergen serums and gently prick the skin, if you do happen to be allergic, you'll feel itching, some minor itching, but no pain. It will not burn, it won't hurt or anything. So no worries about any pain or anything, just a little bit of itchiness. And then I'll go through and mark all the positives and the negatives, and then I will cleanse your skin and give you any ointment for itchiness if you tested positive or anything. Right. Okay. How does that sound? Do you have any questions for me? Yeah, so we do have a control as well, and we have a positive control and a negative control. So obviously the negative control would be just a plain serum with nothing in it, so you're obviously gonna test negative, so there's no allergens in it. And then the positive would be a histamine serum, and so if you have not taken any antihistamines, then the histamine will always come up positive, and that's good so that we know what a positive looks like on your skin. Usually it looks like something like a mosquito bite, some redness, some a bit of a raised bump, but yeah, so the histamine will show us what a positive looks like for comparison to other potential positives, and it will ensure that you haven't consumed any antihistamines. Right. Okay. Because if the histamine comes up negative, then that means the whole test is invalid and we'd have to do it all over again. So yeah. Right. Any other questions? Okay. Let's get started. I'm just gonna sit down my notes here. So first I'm going to cleanse the testing patch of skin. Okay. Like I said, this is just alcohol. Are you wearing any sort of creams or lotions, even perfume, sunscreen? Okay, that's great. Sorry, I'm removing your sunscreen on this little area here, if you don't mind. Okay. Right. That should about do it. Right, and I'm just gonna let that air dry for a moment. Yeah, and please try not to touch that area until the testing is complete. So I'm sorry if you get an itch or anything. I can't have you touch it. Sorry. Yeah. Alright. And then let me just prepare the first first testing group here. First testing group. So I think first I'm going to do tree pollens and grasses and weeds, just to rule out those. I think those are some of our most common allergens that people are allergic to. Okay, you should be about dried up now. Okay, so what I'm gonna do is take some of the serums and just drop onto your skin here. Okay. And then mark them. So I have to do them in a particular order. In the order, we always do the same order, and then I will mark according to the order of which particular allergen, starting with the grasses. So it says ragweed. Just going to put it right there. Okay. Right, and then next is grass. Grass is just gonna go right next to ragweed. Okay. How does that feel? Yeah, shouldn't feel anything yet. Right, and then I'm going to do our first tree. This is elm. Okay. Then next should be juniper. Let me get juniper. This over here. Okay. And next to elm we do juniper right here. Okay. Then after juniper is maple. We don't have maple trees in our area, so this might not apply to you, but if you ever go to Canada, it might be important. Okay, maple. Right. And then we have birch, cedar, and ash. Birch, cedar, and ash. Most people are not allergic to these, but we include them in the panel anyway. Birch. Put it right below the first one. Okay, and then cedar. Get over here. Cedar. Right. Okay. And forget the ash. Ash. Where is she? Okay. Ash in the bottom. Right. Very good. So now I am just going to mark using the marker. This is meant for skin and it washes off very easily. It's very soft. First, I just do the grid and just go through and mark each one. So first we have R for ragweed, G for grass, and then next we have E for elm and J for juniper, right? And M for maple. B for birch, C for cedar, and A for ash. That shouldn't be loaded there. Okay. And then next, what I'm going to do is I'm going to be using this tool. So now I'm going to lightly prick the skin in each spot here. You shouldn't really feel anything. I'm hardly just breaking the first layer of skin so I can get into your system. Okay. And now, just wait a few moments. And while I'm waiting here, I'm just gonna prepare the next group. Okay, so rated frogweed in the grasses and trees. Juniper, maple, birch, cedar, ash. Histamine control. Can't forget the histamine control. And then, hold on a second. I'm just gonna put a little box with the negative control here so there's nothing. And then, hold on, let me get the histamine. Oh, I don't need to mark the histamine because it's red. It's quite obvious that it is the histamine. Oopsies. I'm just going to let that go into your skin. Okay. Very good. Sorry about that. Now we can wait just a moment and please do not touch. Do not touch. Do not touch. No touch. Right. So next I'm going to do, next is going to be house dust and mold. House dust and mold. And then the metals as well. So, right. House dust, mold, metals. House dust, mold, metals, and metals. Okay. So, I wanted to ask, since you were concerned about your jewelry, do you know what metals are in your jewelry? Okay. I am a little concerned about nickel. Most commonly when people have a sensitivity to jewelry, they actually have an allergy with nickel. So, yeah, I was just wondering if you knew if your jewelry was nickel free or... That's okay. Yeah. And we'll find out soon. If you have any problems. Okay. Just give me one more moment. Just going to prep the next here. Here's nickel, right. And okay. Yeah, you. Let me see here. Looks like we're about done. Okay. Yeah. So I'm just going to record positives and negatives now. Starting with our positive control. So yeah, here where our positive control was for histamine, we do have a reaction. It's a little bit itchy, isn't it? Yeah. So that's good. You don't have any antihistamines in your system, which means our testing today is valid. That is very good. And your allergic reaction here looks quite normal. Like I said, it's like a mosquito bite. Yeah, and so let me see. I'm going to, after I mark all of the positives, I'm going to measure each of them. I forgot to mention that to you. So we measure all of the positives so that we can see how, like, the degree that you are allergic to something changes over time. So a bigger mosquitoid is what we'll call it, bigger blemish that comes up is a greater allergic reaction. So let's say you get tested again in 1 year from now, and let's say that your histamine is 4 millimeters. I don't know yet because I didn't measure it. And if you come back next year, and it should still be 4 millimeters because usually your reaction to histamine doesn't change. Let's pretend that you tested positive for silver, and silver has a 4 millimeter reaction. And if you come back next year and it goes down to 2 millimeters, then that means your body built up some sort of immunity to it and you're not as allergic as you were. Now that doesn't happen as much in adults, but if you ever hear about kids who like grow out of their allergies, that's usually something that can happen with kids. Anyway, we measure just to see changes over time and sort of quantify how severe or not severe is the allergy. Sorry about that. Right, so I'm gonna mark my positives. Sorry. Yeah, we got histamine, and then let's take a look at ragweed here. Take a look at ragweed. You're good. No reaction with ragweed is negative. And then grasses is also negative. Okay. And we are moving on to our trees. We have 2 positives here, and that is both elm and juniper. Both elm and juniper, which we do have in our area. So yeah, you might experience to some degree some seasonal allergies. That's probably why, is the pollen from those trees. So, okay, and then we see maple, birch, cedar are all negative. Negative maple, negative birch, negative cedar, negative ash. Okay. So the positives that I will be measuring now is the histamine control and elm and juniper. So what I'll be using is this special tool. We just measure the diameter of, so I put it up and then match up the diameter of this to be, okay, then I can read the value. So yeah, your histamine is at 3.5 millimeters. Just write that down, 3.5 millimeters for histamine, and that is within normal values. We usually say like anywhere from 2 to 6 would be normal. Okay, and then I go over here to excuse me. Measure. Coming in at about 2 millimeters. For it's actually pretty mild. Yeah, I would say 0 to 2.5 is considered mild. So yeah, you're just on the upper end of having a mild reaction to elm. And then just measure juniper. Okay, juniper. Okay, about 1.5 for juniper. So again, elm and juniper are both very mild reactions. So yeah, your allergies probably aren't going to be very severe, which is why you might not have noticed that you have them. But if you really get in close contact with the pollen from these trees, you may experience some itchiness of the eyes, some runny nose, things like that. Yeah, so yeah, we'll just keep that on record for you. And juniper and mild allergies. Okay, so I'm just going to clear that off. At the end of all of the testing groups, I'll apply some help with any itching from those. Positive. Shouldn't be too bad. Sorry. Alright, now moving on to the next testing group here. I told you earlier house dust, mold, and metals. I also want to do cats and dogs, just because you said your mom was allergic to cats, so I wanted to see if that was something you inherited. Yeah, we often do inherit that, unfortunately. Okay, so starting here with house dust. Okay, and then next, doing common mold. So a lot of people are allergic to mold. Okay, and then next is nickel. Okay, right. And then silver. Okay. And then gold. Gold, very good. Okay, and then finally copper. Okay, and those are the metals that we test here. Okay, let me get my pets on. Over here is the okay, these cats. Put that right up here. Cats. Okay. And then doggies. Doggies. Okay. Right. And this time I will remember histamine. Don't really need to do it again, but it's just good practice to always have the positive and negative control mark next to your tests. So, okay. Again, I'm just going to walk right around these and separate my negative control, histamine. Okay, and then we have H for house dust. And we have M for mold, right? And then we have N for nickel, and then G for gold, S for silver, and C for copper. Okay, you can do CT for cat and D for dog. Right, we're all marked. I'll just be going in and pricking the skin just to allow to get into your system here. So sorry about that. Just feel a little tickle, just a little prick. Okay. See, not bad. Not bad at all. Okay. Just double check that I didn't forget anything this time. Wait a moment. I already did grasses and weeds and pets and trees, metals, controls, positive control. Okay. I didn't forget anything. Okay. Yay. So, let me just wait one moment. Okay. So, I guess I'll tell you a little bit about what's gonna happen next while we're waiting for the test results. So, yeah, after we get these results, once again, I'm going to take note of positives and negatives, just like last time. And then again, same as last time, I'm going to use the tool to measure all of our positives, take note of those measurements, and then all of your results will be sent to the doctor, and then the doctor will discuss at a separate appointment with you in detail about any like action plan or treatment plan for managing your allergies, which we already know you do have a few at least. Yeah, and then like I said, I'll cleanse the skin, don't worry about it. And then for any of the itchiness, I'll apply a cortisone cream, and the itchiness should go away within the hour, usually within 30 minutes. And you can go back to work, go about your day, do whatever you want, or use this as an excuse to have the day off. I wouldn't blame you. Yeah, and then that's about it. Yeah, okay. Let me take a look here to see how we're doing. Yeah, I'm seeing. Yeah, we got positive for histamine again. That's good. Okay, I'm not gonna measure your positive histamine, but good to know. So we're about ready now to mark these results. Okay, and first is house dust. House dust. Negative. That's a little bit surprising for me. I don't know. I expected you to be positive. You strike me as someone who's allergic to house dust. Negative. Okay, and then we had common mold, which I think you're gonna be positive for. Yeah, I was right this time. Okay, you're very positive for mold. Quite positive for mold. Yeah, avoid mold. I mean, even if you weren't allergic, I would say like just stay away from mold. Nothing good comes out of it. Okay, and then looking at our metals, we had nickel, silver, and gold. This is what we were concerned about, and it looks like you are allergic to nickel. Yeah, I have a positive for nickel. Bad silver and gold, you are negative. That's good. People are always upset when they test positive for silver and gold. Okay, and then write the pets. I'm praying that you're not allergic to pets. And you're good. Oh my gosh. Yeah, no cat allergies. That's good. So negative and negative for cats and dogs. Woohoo. Okay, so the positives here was mold and nickel. So let me just measure those using this tool once again. Okay, so yeah, so this is a bit bigger than your previous positives. We're coming in at about 4.8 millimeters. That is reaching the more severe allergy. Yeah, so the doctor will definitely have a talk with you about that one. And then nickel. Honestly, your nickel allergy, just from my eye, is looking quite average, but let me see here. Yeah, coming in at just over 3 millimeters. That's just about average, but it is still something that could certainly bother you. So you were right to wonder about your jewelry. I bet you at least some of your jewelry has nickel in it, and that could be what's causing. Definitely could be, but yeah, but like I said, the doctor will discuss it in more detail. I am just conducting the test today. Did not go to med school for like 8 years or whatever. So, yeah, that is it for your testing. Let me clean this off. And after I clean it off, you are free to scratch away. I don't recommend you scratch a lot though, because it's kind of not good for your skin. But I'll at least touch your skin now after. To get a little bit more. This in here. Are you feeling a little bit itchy? Yeah. Is it like, how bad on a scale of 1 to 10 is your itching? Like a 7. Okay. It's probably that mold. Your reaction to mold was surprisingly really bad. And I'm also allergic to mold, but you're a lot worse than me. Which got me thinking, like, maybe you've come into contact with mold. I don't know, if maybe somewhere at your workplace or your house. I don't know. It just makes me wonder. That could be causing your problems. Okay, just let that dry a bit. Let me prepare your cortisone cream. Have you ever used cortisone cream before? Yeah, like a Benadryl cream. This is similar, yeah. So this is going to help with that itching. Also, it's pretty moisturizing as well for the skin. Just to go like this. Very softly, really concentrating it on the positives. It's a good thing you came in today. Very good thing. Okay, and just wait a moment, let that absorb into your skin. Do you have any plans after this? Good. Yeah, I'm supposed to tell you that you're good to go back to your daily life, go to work or whatever, but personally, I say take the day off. Anything to take the day off, I say do it. Just tidy up the area here. My little trash can. Okay. Yep, we've completed my checklist of everything I need you to do, so yeah, you are all set today. Thank you so much for choosing our clinic. Yeah, good luck with your nickel and mold and tree pollen allergies. Yeah, the doctor is gonna help you out with that and give you a little bit more help than I can give you. Sorry. Okay. Yeah, you're good to go. Bye bye. See you maybe in like a year from now. Good luck.